Hello, I'm Melissa Mulky, a neuroscience clinical nurse specialist and PhD student at East Carolina University. I'm the first author on the article we're going to talk about, Pathophysiology Review, the 7 neurotransmitters that impact delirium. Have you ever wondered why delirium is described as a syndrome of many etiologies with one end product? If you have, you're not alone. This can occur because acute illness stresses the brain, especially if it was impaired to start with. When our bodies are under a lot of stress, it impacts the whole body, and that includes the brain. The brain operates by way of chemicals we call neurotransmitters. Stress causes changes in these chemicals. The ones thought to be the main players in delirium are dopamine and acetylcholine. When the brain can no longer adapt or compensate for the severity of neurotransmitter imbalances, we begin to see behavioral changes. When these neurotransmitters become abnormal, they impact the electrical activity in the brain that we see on EEG screens. The electrical activity, or EEG, is more sensitive to these imbalances. Therefore, we will see distinct EEG changes before we begin to see behavioral changes. As such, these changes are considered to be biomarkers. So you're probably wondering why this is important to nursing. Well, it is because knowing this helps us understand why some medications are more problematic than others, and the severity of these changes may indicate how imbalanced their sleep cycles are or will be. Currently, there isn't an objective continuous monitor other than full EEG. As technology progresses, providing a few more changes, we may be able to get this information in a manner nurses can use. Now you're probably thinking, and what is that? The bispectral index monitor, or the BIS, may be the answer. It currently monitors EEG to provide a number, the index, to indicate how conscious or unconscious a patient is. By adding a formula to assess the same wave in a slightly different manner and combining it with the index, we may have a machine that can continuously assess for the earliest signs of impending delirium, the EEG.